Righty. Hello, everyone. This is Mark Anthony with AI Edge Podcast, a place where we bring you the best of the best doctors in their niche. Remember, sharing is caring. We want to make sure that we can get the information out to people. Why? Because one video can change one person's life. Today, we're going to be meeting up with Dr. Sarah Duke, and you probably just call her the Activator. A little no pun intended. But today, we're going to be talking about something very different. I've never had on the show, never talked about it on the show. And the cool thing was I've used this before, and I'll tell my story. But before we do, the topic of today is going to be what happened after using the activator. Shocked me. So Dr. Sarah's going to talk about the activator, but before we do, I'd love to introduce you to Sarah Duke. Dr. Sarah Duke, thank you for being on the show.
Thank you for having me.
Of course. And so before we get into the activator, if you could maybe tell us a little bit about how you got into chiropractic. I know the office is going into a 9-year reign. Tell us your story, and then we'll go into the actual story we want to talk about.
Great. Yeah. So I actually found chiropractic when I was pregnant. Initially, I was probably 23 years old and I was already a massage therapist. I had done that since I was about 18 and I loved it. I was like, wow, this is what I should be doing. So when I walked in, it was like the exact advanced level body work that drew me to, the future that I experience now. My husband and I built this practice together. So after chiropractic school, him and I decided to open our own practice. He's been a massage therapist for 30 years. So for us, this is just like our passion. It's what we're good at. It's what we know. Both of us have done body work since I was 18 and he was 23 when he started. So it's what we know.
Well, so that's kind of cool. You guys are working together. You guys are pretty much passionate about the same thing. I mean, you crack, he massages. I mean, it kind of works out perfect.
Yeah.
And so how long has he been massaging?
34 years, I believe.
No
Yeah,
way.
it's been a while. Yeah.
Wow. So that's kind of cool how you got into the chiropractic and it just kind of worked perfectly simultaneously together, because most practices these days they have massage therapists.
Mm-hmm.
You
Yep.
know, that's awesome. Now, I know that when I first talked with you on the phone, you intrigued me a lot. You said that you use the activator, and I was like, what the heck is the activator? So, maybe tell us a little story about this. Do you have the activator next to you?
I do not, but I could run back and get it.
Yeah, go for it. Run.
Yeah.
It's all good. We're not going anywhere.
So let's see here. This
That's
is the
cool.
activator.
Okay. Does something shoot out of it? Is it air, or how does
Yeah,
that work?
so essentially you put it on a joint and clip.
And
So
then,
this is calibrated specifically. I can turn it to get it calibrated to the right part of the body for the amount of pressure it's gonna push out. And essentially we use it on various joints, very specific parts. We do muscle testing to kind of, figure out what segments are out in what areas. It's actually the most scientifically researched technique that's out there in chiropractic. Most chiropractic, you just push and, let God kind of take care of the rest.
right.
With this, it's very calibrated. It's very specific. It has a very specific angle if something's out. And quite frankly, I find that this works better for people that have pretty severe neurological issues, people that just can't tolerate manual adjusting at all. They respond amazingly well with this technique. I recently had somebody come in with MS who was just really struggling to walk. And I did 2 or 3 treatments and already he was not falling as often at home. And just in a couple of treatments, it's really some life-changing stuff. And if I would have manually adjusted him, he really would not have responded well. And, a lot of these people with these really severe degenerative diseases, they don't respond well. So
Wow.
that's
So
kind of where Activator comes in.
how did you find out about this? I know that you were working for somebody, I believe, and then you noticed they were using it a lot. How did that work, and how did that start to kind of pique your interest? And you're like, I got to try this.
Yeah, so I had my 3rd child right in the middle of chiropractic school, which is probably the most inconvenient time to have a child. But that's how I kind of found Activator as well. So after I had my third child, I had a hip injury that was really severe, and I was almost dragging my leg to get to class, and I could not walk very well postpartum. And so I walked into my basic Activator class. I just started taking this technique in school.
Mm-hmm.
I had no idea about it, never really heard about it before. I'd had it used on me, but not really like the protocol or anything. And my teacher took one look at me and was like, get on the table. We're fixing you today. And so I was the example for the group for that day. And she was basically just showing us, it was probably 2 or 3 weeks into the semester. So we had just started the class. And she was like, I'm going to be doing all the advanced techniques on her today because she needs it. And so she just did this entire protocol on me, and I walked out of that class literally pain-free. And I was just like, what is this all about? But whenever I finished school and was looking for jobs, there were no Activator jobs. So I did advanced Activator in school. I did the basic and the advanced, but there's no jobs for it. Like most people do manual adjusting. So when I got my first job out of college, I was only doing manual adjusting. So I kind of had to grow my skills in that area. And it wasn't until maybe 4 or 5 years after school that a local chiropractor in Austin had a stroke. He was like an 80-year-old chiropractor. He had been in the profession forever, one of those legendary guys, you know. And he had a stroke, and I covered his practice for a while, and he did Activator only.
No way.
And that's how he was able to stay in practice for so long into his advanced age too. So I started covering for him, and I was like, oh my God, it's like magic. And it was just all the magic from before just kind of like came together. And I was like, that's it. I'm adding this to my practice. This is going to be part of what I do now.
Wow. So that's kind of amazing. So I've used the activator before. So, I think it was a baby activator. I don't think it was like you know what I'm talking about.
Sure.
There's different types of activators. I went to it was like an indoor swap meet up in Portland. And Portland's already weird. So, it's,
Of course.
there's so much going on. It's really
So
cool.
is Austin.
Yeah, totally. So I went there, and this guy was doing this clicking on people. And I was like, what the heck is that? Long story short, he started clicking on me, and I was like, oh my God, that feels so good.
Yes.
It felt like I got adjusted. I can't explain it. It doesn't make sense to me. I don't get it. I really
Sure.
doesn't. Even still today, I don't understand how you can adjust somebody without adjusting somebody. I mean, it's a little clicker, but what I do know is that clicker, I bought that clicker. I loved it. And I'm like this close of buying another one, but there's so many activators out there. I'm like, I don't want to buy the wrong activator. It sounds kind of funny. You know what I mean? But at the same time, maybe you can tell me how can you adjust somebody with an activator without adjusting and hit, moving their neck and throw them against the wall? I mean, I don't know. How does that work?
So the great thing about it is you're essentially just moving the bone millimeters. So you're not doing anything super aggressive and working almost against the body, which sometimes manual adjusting can do that depending on people's responses to care. That manual adjustment is just breaking through a lot of stuff. And the reality is only about 2 to 5% of our population sees chiropractors in the first place, and a lot of them are scared. And this is one of those techniques that can kind of bridge the gap and kind of meet that 98% people that don't like being touched. This is a great technique for them because I'm not actually I'm using this as touch, but it's not. There's some people have weird sensation issues, and this actually kind of checks all the boxes. So you can actually meet the needs of more of our population with this technique versus the manual adjusting.
Well, is there a spark? Does anything come out of it?
Is there what?
When you click on it, is there like a spark? What is there? What?
No, there's no spark. It's just pressure, but it's very calibrated. So what you do is you place it right beside the bone and click, and it either turns the bone this way, this way, this way, whatever way it needs to go. So it's just incredibly specific. the way I kind of explain it to people is I put everything into place while you're laying on the table. And then as you get up and move around, everything will then kind of click into place. But
Oh,
it's all very subtle, and it's not the abrupt movements that end up scaring people away from chiropractic.
wow. So are you currently just using that in your practice, or how does that work?
I'm about 50-50. So I let the patient guide me on what their
What they
condition is.
want?
Yeah, and what they're coming in for. Because I did start my practice manual only. And
Mhm.
so I added Activator after the fact. So I would say at this point, my practice is about 50-50.
That's strong. So how do you implement it when someone says, okay, I want to see they want to see as a chiropractor? Do you give them the option, or do you just say, hey, this is what I do? Would you like to try it before we knock it?
So it depends on what they're coming in for, of course. So like
Okay.
if they're coming in with like Ehlers-Danlos, which is a condition of extreme ligament laxity,
Right.
I'll automatically go to Activator, and I'll recommend that before any type of manual adjusting. And
Okay.
most of the time, after people that have neurological issues, all of these things, it just kind of depends on the consult. And I'll kind of navigate them toward Activator if I
Okay.
feel like that's the better option for them, especially people that come in and say words like, I've been to a chiropractor before and
Mhm.
not had any good results. If they're saying things like, I've been injured by a chiropractor, anything along those lines,
Right.
I'll always guide them toward Activator protocol. And then they are always welcome to say, hey, I think I need a little more. And we
Mhm.
move into more manual adjusting if that's something that they want to explore.
Okay. Do you do it? Do you sometimes do it to where you'll have somebody say, well, they want to be adjusted, but they want the activator?
Yeah, yeah, I have. In fact, whenever my husband has injured himself, because that happens a lot in this field, like when you're a body worker, you're constantly trashing
Right.
your body for other
Yeah.
people. Um, so there are times where my husband is severely injured and he only wants Activator. And then there are
Wow.
times where like he's feeling okay and wants a manual adjustment. So I allow people to kind of gauge where they're at the day that they come in. And I have some people that flip flop back and forth between the
Mhm.
two. Some
Wow.
people only want Activator on their neck. The rest they're fine with getting
Interesting.
manually adjusted. So it just depends on the person and what they're looking for.
I love it. I think that it's giving people a choice, but I mean, in my brain, I'm already thinking in my head like, man, that'd be a good ad, chiropractic care without the crack. Just
Yeah.
something like, it just kind of gets because if I saw that, I was like, what? Then what do you do? You
Yeah, I
know?
get a lot of people that say that, and then they get off the table and they're like, what on earth? What kind of voodoo was this?
Oh my
And I'm
God.
like, it's the best kind of voodoo.
Who came up with this activator? I mean, do you know where it came from? Who invented it
Yeah.
or anything like that?
Yeah, so I always wonder about this. I'm like, these guys, like, who came up with it?
Yeah.
Who
Somewhere
sitting
in England
around
or
one
something.
day and we're like, hey,
I know.
what if we do this? Like, what happens, But honestly, I think a lot of these techniques, believe it or not, come from like ancient times. A lot of this stuff that we do now, we think that we've invented it, but it's actually been around long before we ever came around. But activators specifically with this specific tool was developed by Alan Fuhrer,
Hmm.
which he's a chiropractor and he's
He's still alive?
I believe so, yes. I
No
don't think
way.
he's aged, quite a bit,
Uh-huh.
but I'm pretty sure he's still around and he's the face of Activator Methods. So if you
Ha.
look up activatormethods.com,
Right.
you're gonna see his face right up there front and center. And he kind of is the promoter and everything of this. But even with like Graston and Gua Sha, where we're like scraping scar tissue out of certain areas that are problematic and not moving well, there was ancient techniques like coining. So they used to use coins in ancient China and scrape scar tissue out of areas so that people could increase their mobility
Wait,
and
how
flexibility.
did they do that? Like, so if you have like a scar, or how does that?
So we all have scar tissue in our body from
Right,
all the injuries that we've had in our lives. So every time I've bumped my knee, a little bit of scar tissue will build there.
right,
Everything I've stubbed a toe, so on and so
uh-huh,
forth. So we have scar tissue all over the
right,
place
right.
from all the bruising and, whatever we've done in our lives. So sometimes that scar tissue, people tend to hit the same spots over and over and
Yes,
over. And it's always the right knee or my
it.
hip or like,
Mhm.
it's always like that one area. And so when scar tissue builds up there, you just get it out with scraping. And that's
So you
all.
just scrape
Yeah. So there's
with
like
a
a
coin,
stainless steel tool that looks very much like a butter knife that, the non-serrated edge of a butter knife,
right?
and you just get in there, and I've scraped all over the place on people. I've had athletes tear their quads and I've scraped all around there to kind of smooth out that tear. I've scraped necks, shoulders, frozen shoulders.
What is it? Is it the silver in it, or is it or
So
is
the
it?
the tools I use are stainless steel, but there's like buffalo horn and there's jade stone and
I
there's
heard
all
about
kinds of,
the jade stone. Yeah,
yeah, like there's all sorts of things that go along with that. But
and
it's
then you use the
all from like
activator,
ancient stuff, huh?
and then you use the activator.
Right. And then I know I'm a little bit aggressive, a little bit light touch. I'm very versatile. I can kind of treat multiple things in people. So
I love it. Yeah, I'm sure you keep that activator in your purse at all times.
I've actually gone to the airport with it before and they've checked it at TSA.
Like,
What is
what
this?
is this?
What kind of gun is that?
No, it's the activator.
And I'm like, it's the activator. You should try it. It's
Oh my
amazing.
gosh. You should coin that, missactivator.com.
Yeah, I
That would
know.
be, seriously, that would be really cool because with the technique that you're using is a good way to get people in the door that normally are not into chiropractic.
In fact, there's not a lot of people in Austin that do activators. So I really don't have to try really hard to advertise for activator because I think there's 5 people in the entire city that does it.
Really,
So it's not a lot of competition, which is rare for Austin because everything's
it's
competitive here.
competitive.
Yeah, there's a
Everything's big.
chiropractor on every single corner.
Wow. So tell us, is there, maybe not is there, but how could you explain maybe a lot of the services that you have to offer, because we're talking about the activator, but maybe tell us about the services that you do offer in your office, because there's going to be a lot of people that are, we like to target whenever we do a podcast to your area, to your local area, of course.
Sure.
Maybe tell us a little bit about some of the services you offer and maybe if you have any specials, anything like that.
Yeah, so actually we have a special going on right now for our 9-year anniversary. We're doing 15% off all of our services through the end of April. And then we're also doing $9 add-ons. So cupping, gua sha,
It's
all of
good.
that is a $9 add-on for our 9-year
$9.
anniversary.
That's awesome.
So yeah, so that is a special we're doing right now. My husband, like, it's interesting because we've been body workers for so long that our knowledge is so vast. We actually do a lot of different techniques because we've had different phases of our careers. So my husband's specialty is lomi lomi massage, which is a Hawaiian massage.
I've done
Very much, it's like your arms
amazing.
create the waves of the ocean up and down the
You're in
body.
heaven.
It's like a spiritual
No,
experience.
I did it for like 2 hours.
Yeah, yeah.
And in 2 hours feels like it's 30 minutes.
Yes. And afterwards, you're like, what just happened? Like,
Uh-huh.
you start contemplating your life choices.
Yeah, you do.
It's
100%.
Yeah, it's like such a spiritual experience. And sometimes he'll do a little reading or something, depending on how receptive the person is. He tries, we try to gauge our people. Some people are very like spiritually open, and some are very
Spiritually
spiritually
dead.
closed. And they're like,
Yeah.
no, we are in Texas. So you
Mhm.
have plenty of conservative people coming in that are
You're
like,
like,
I
what
don't
is,
know.
yeah. You're all,
I don't
what's
know if I can
loamy
do
loamy?
this. This might be
Oh,
good.
you're all, is this mystical? It's love.
Right.
No, and I'm not gonna lie. When before I did loamy loamy, I did do a bunch of research.
Yeah.
I'm like, okay, do I got like a witch doctor on me doing loamy
Yeah,
loamy? It just sounds weird, loamy loamy.
sure.
You know?
And, it feels that way for us too. We feel like witch doctors sometimes.
Yeah, but you know,
With the
it's
activator and the
you're
Lomi,
I
it's
know,
kind
huh?
of,
We got the activator, we got a little bit of loamy loamy, But I think that people are being more open these days, and I think that's good. I mean, you are in the Bible Belt, I
yeah,
will say, but at the same time, we have so many people from California moving over there,
sure.
So you have loamy loamy, you have the activator, you have regular chiropractic,
Mhm.
and you have the cupping,
And
and
then my husband also does craniosacral therapy, which
okay.
is like
Oh wow.
also very, it's a very light touch technique. So generally when people are coming in with really severe symptoms that they've been to all the doctors and nobody has answers for them, we generally start them off with activator and craniosacral and see how they do, see how they
Nice.
respond to that. And it's really cool. Like I said, we've learned these techniques in different phases of our own spiritual journey and our own part of body work. And like we've just done it for so long. We've hit so many different boxes over the years of things that we treat. My husband's really good with athletes, but also really good in the spiritual realm, So I feel like both of us can kind of slide back and forth pretty easily from like a spiritual aspect over to that more clinical, like very doctor, specific. We can kind of bridge the gap and go between the two pretty easily just based on all the years.
That's awesome. Tell us, maybe you have some cool stories about using the activator and what you've seen it do.
Yeah. So, like I said, I had that MS patient recently. I also had a kid that I was working on that had pretty severe nonverbal autism, and I started working on him. That was a really challenging case. This was really early on when I started using activator in practice. And within about 3 months of treatment, some sessions he was really upset and screaming, and the activator was the only thing I could use on him. And eventually he got to a point where his nervous system started regulating and he became verbal again, which was amazing for the parents. They were just like, I knew that there was just something off in his body and something wasn't connecting in his brain. And I could go on and on. I've had a lot of like really crazy things where I'm like, I feel like that probably shouldn't have happened, but all I'm doing is trying to put stimulus into the nervous system and kind of nudge people where they're supposed to be. But we lost audio.
There we go. What's the
Yeah.
biggest thing that you saw that turned the light on saying is I need to do this in my practice? Was it because of what you saw happen to you or what you saw when you started utilizing?
So when I covered that other doctor's practice, I saw so many people like he was elderly and his population was elderly as well. So a lot of them had severe osteoporosis, some really bad degenerative conditions. And I saw them getting better like every day that I would go cover his practice. I was like, this is amazing. Like people who are trying to avoid or put off surgery are getting better, and they're able to actually avoid and put off surgery when they cannot. There's no way you can adjust somebody with severe osteoporosis, but you can do it with this instrument and give them relief
Wow.
where nobody else can. It's just incredible.
So I'm more intrigued. I know there's different types of activators, but now I'm more intrigued about this guy. I got to go do some research on him now. You got me all intrigued.
Yeah. Yeah, I don't know if he's necessarily the inventor or the technique, but I know that Dr. Alan Fuhr, he has pushed for all this research to be done. And I think that's what kind of makes activators so cool, is that there's so much research behind it. It's not voodoo. It's not some crazy mystical thing. Like it's reproducible over and over.
It's energy.
All the muscle testing is very neurological responses, and it's very specific, and it every time, like it's wild. every single time I do the muscle testing, it tells me exactly where to go, what to adjust, and it
Wow.
just works every time.
Have you ever done like a live, like recording it?
I have, yeah. Yeah, we actually have a YouTube channel that
Mhm.
has a pretty good following on it. And I do a
Oh,
lot of
wow.
Activator on there. And it's kind of sad because I know you're not supposed to read the comments on your videos and stuff
Right.
like that. And
But we do.
and I went in one day and I read it and I was really kind of sad because there were a lot of chiropractors on there, or not
Really?
chiropractors, I'm sorry, medical doctors,
Okay.
but also chiropractors that were like, chiming in and like, this is quackery, this is not, scientific, blah, blah, blah. And I mean, long, long thread. And I just feel, I'm like, why are you so closed to something that could help somebody? Like, it just doesn't make any sense to me why anyone would fight it if they also don't have answers for people.
You know what? You're right. And, here's the good news though. I love it when I get negative feedback because that shows that I hit a nerve. So
Right,
now guess
right.
what? I have rent space in your head and they're curious enough. They're going to try it.
Yeah,
You know what I mean? I
I
mean,
know.
and if people like without physicians, just regular people, I'd have fun with them.
Yeah,
I go, hey, are you currently in the area? No. Well, yeah, I am. Awesome. Come on by. I'll give you a freebie.
right.
And next you know, they become a client.
Yeah, I know. I know. I mean, I've had a lot of people that are like, "Oh, I'm really skeptical about this." And then they are really blown away. And it's sad because chiropractic sometimes ends up being the last resort for people, and I always
Yes.
feel like it needs to be the first. Like it's the safest thing you can possibly do to
I
see if to mitigate
It should
anything.
be in it should, my opinion, it should be in doctors' offices around the world. Like if I go to the
Sure.
doctor for surgery or whatever, and you're gonna work on my back, give me an adjustment because everything's about blood flow. People don't realize that if your back's like this and then it's like this, it's you got a blood flow problem and everything. Without blood flow, you die. You
Right.
know what I mean? And when
Yeah.
you have things that get clogged up, people don't realize chiropractic, if it's clogged up, you're getting pain. It's because now you have inflammation. So we need
Right.
to unlock that inflammation. And that's also what the activator does. It unlocks.
Yep.
So if you have a knot in your back and you're hitting that activator, it's hitting around and it's loosening that inflammation or that rock. Or I don't know what I call it, calcium. I don't know what or a
Sure.
knot would be. I don't know. I'm just using, I'm not a doctor, but you're breaking that calcium down, whatever, so that can have better blood flow. I mean, I use a thing called the Beamer, and I don't know if you've ever heard of it, but it's a mat, and what it does is it actually activates the blood flow in your body. And they've shown how first, if your blood flow is really slow, that once you get on this mat, it speeds it up, so it starts to heal the inflammation in your body using NASA technology, I believe. So, but people would be skeptical about that.
Sure. Yeah.
The activator's cool because a lot of things that are being done with people with systems, people don't feel anything. And we're touchy feely people. With activator, you can feel it right away work.
Yeah. Yeah,
Wow.
it's pretty cool. Yeah.
Yeah. So I'm amazed. It's just kind of cool. This is the first time I had somebody talk about the activator. I actually forgot about it because I don't know if you remember, but I was telling you that I bought a little mini activator and my God, I used it for everything. I mean, I kept this sucker in my back pocket. Then my kids started playing with it, click, click, click. And I'm like, okay, I was like, dude, don't be wasting my clicks.
Right.
And then, not that you could waste a click. I don't know. I don't know enough about it, but they took it apart. And I was like, dude, you took my, I was
What were you
frustrated.
thinking?
Now I want one talking with you, just to
Yeah.
have. But thank you so much for being here on the show. I'm excited to get this all doctored up, no pun intended, and get this sharing on people's pages. I think that knowledge is power, and we need to be open minded, not closed minded. And it's interesting. What got me interested in chiropractic for myself was I remember maybe 25 years ago, I had a slip disc, couldn't work for it about a year. I couldn't sleep on a bed. I was in so much pain. So I slept on the ground and they were trying to, get me to work out, do light workouts and stuff like
Mhm.
that. And I was getting worse. And next, they were trying to get me on to, instead of trying to heal me, they just said, oh, well, let's put you in a different type of work.
Right.
Somebody said to me, you should go see a chiropractor. I was like, what's he going to do? Long story short, it was kind of my last hope. I went to go see a chiropractor, and my life changed. Within 30 days, I was no longer in pain. My disc healed by
Yeah,
itself because our body's created to heal.
that's right.
People don't realize that. And so I fell in love with chiropractors ever since then. I had a regimen. They were adjusting me once a week. And now I can swear by them. But what's very interesting is a lot of people don't understand how chiropractic got started. You
Right.
know, it amazes me today. We can't explain it. But when I think it was Palmer, Mr. Palmer was adjusting somebody and the person was deaf
Yep.
and all of a sudden he could hear. Can't explain how that happened, why it happened, but the way that he adjusted, it started a revolution.
Well, you can explain it because
Yeah, I love it.
he ignited the nervous system
Okay,
and
yes.
allowed the nerves to start communicating the way that they're supposed to. Just like that little kid started talking out of after 3 months of care, his brain wasn't communicating the way
Wow.
it was supposed to with each other. And once we got it communicating to each other, I'm not saying this is going to happen every time, but
Right.
like it was a miracle to watch this boy go from nonverbal screams and things like that, like loud sounds, to all of a sudden seeing his brain start connecting and communicating side to
Amazing.
side and then verbalizing. I
Wow.
mean, it's kind of, those are like those chiropractic miracles that we see sometimes, and there is explanation. It's a neurological
Mhm.
response. You're putting stimulus into the spine and trying to see if you can elicit a response.
You're right.
And sometimes it
100%.
works, and sometimes it takes a little longer and it's a little
Because
lingering.
everybody's body's different.
Sure. Yeah. I tell people that all the time. Sometimes people get adjusted and they're better the same day. Sometimes they have to get adjusted 5 to 10 times before they're like, oh, it's finally starting to work.
Right, right.
And you never know who those people are going to be.
You're right. And a lot of people don't realize that your body's like a car. When
Yep.
you get adjusted and you see people, oh, this is great. And then you see them not schedule another appointment. That irritates me
Yeah.
because there has to be consistency.
Right.
You know what I mean? You don't come in just when you're feeling bad. You want to keep up on that body. You're worth it.
Right.
I love old cars. So, I look at it like, I like a 67 Chevy or a Mustang. You got to keep up on it. You got to put not unleaded. You put, the premium, and you are premium. People need to know that. And not
Right.
just that, people out there that are in internet land, come check out Dr. Sarah. If you're skeptical, great. Come on in.
Yeah.
Check it out
Absolutely.
because the best thing that's going to happen to you guys, you walk out with the activator, your body's activated. That's why it's called activator. It activates something that's dormant, blood
Yep.
flow.
Yep.
And then go get the Lomi Lomi. I did the Lomi Lomi for 2 hours. Let me tell you guys something. I'm in heaven. Matter of fact, she's talking about it. If I was in Texas, I'd go connect over there right now and do that. But I'm over here in California. And so, but hey, still, I can get the Lomi Lomi. My point is, everyone, connect with, Dr. Sarah and her awesome husband and get activated, get your body activated. And you're probably thinking, well, I don't need to see chiropractic all the time. Yes, you do. Guys, you do. Your body and you are worth it. And here's the thing. I'm talking to the audience out there. You're worth it. You need to get that in your brain. You have stress every single day to the nervous system by the stuff that you see on your phone, by the stuff that we're hearing with what's going on in this world. It automatically, the body goes into fear and flight. It stiffs up, and you need Lomi Lomi and activator. Thank you so much, doctor, for being here. And this was a pleasure.
Yeah. Thanks for having me. It was a great chat.
All right.